Hello everyone, it's Tim Spector here of the Zoe COVID study giving this week's update. I'm doing it from a state of isolation as last week I caught Omicron, and that probably explains my loss of energy and being bunged up. And I have every sympathy for all those who've been reporting it to us. It does start exactly like a cold, can't tell it apart, except much more fatigue than I've ever had with a cold, and it lays you up for a couple of days, and you really don't feel like doing anything, and then you just get congested and it slowly wears off but takes forever. I also had back pain like many of you did as well, but only lasted about a day, and really I'm over the worst of it now, but according to the government I wouldn't have COVID because I didn't have any of the classic symptoms, like half of you. Thank God for lateral flow tests, eh? And I was also super careful, and I've been basically working from home, hardly saw anybody, so it's still a bit of a mystery how I managed to get it, and I think that is just testament to what we're dealing with here, a very clever, highly infectious variant. We're going to be looking at what's happening to the cases around the country, and has this second mini spike peaked where you live. We're also going to be seeing how much this is due to the new BA.2 Omicron variant that is even more infectious than the first one. And a little teaser for those of you who might have had a strange metallic taste in your mouth after having had a vaccine. Stay tuned, we've got some data on that for you. So, update this week, the cases are around 204,000 a day, which is a slight 4.5% increase overall on last week, but we've actually seen a dip since its peak a couple of days ago, and looks like we're over the worst, and the trend seems to be downwards again overall, and we hope this continues. Never quite reached that peak in January, but I think this idea of having a quick peak which goes down to zero we saw in the early part of the pandemic is gone now, and this recurrent waves of these shoulders or twin peaks I think is how we're going to be seeing it for the foreseeable future. And we estimate that 1 in 25 people currently have COVID, and the highest rates we're seeing are currently in London, followed by the southeast of England and the West Midlands. And we're going to talk about regional differences later, but hospitalizations, the good news is despite these really massively high rates, I mean 200,000 people a day is a lot. That means, at any one point there's a couple of million people affected. We're seeing this down again with hospitalizations lower than they were. About 1,500 people admitted to hospital, and again that's probably an overestimate because they're calling some people as COVID who aren't, and 443 on ventilators. That continues to fall week on week. Average death rate again is about 1,540, again down on last week, and again that's an overestimate, probably by about half, so probably only about 100 a day, which for this time of year is actually pretty small and good news. So we've got this strange news setup. We're getting increasing numbers of cases, reducing numbers of deaths, and I don't think it's just a lag. I think we would have seen big increases in this by now if it was going to. So clearly the virus is doing something in this now highly immunized population. So let's look at the age groups. The prime driver infection was in the last few weeks children. That now seems to be clearly slowing. That's the blue line. And the others are still rising, but that increase seems to have slowed down and is plateauing in some. So we hope the ones, particularly in the older group we were a bit worried about last week, is going to keep following that trend. If we look at the regions, it's really quite a mixed picture across the UK. depending on where you live, you're going to see a different pattern. Some areas going up, some down. Cases really not dropping back to anywhere near normal levels anywhere. They are continuing to rise in London, in the southwest, particularly also the southeast, the northeast and northwest, which were this secondary increase, are now seem to be the first ones reducing, so they're going down. So different parts of the country are going in opposite directions. And what's interesting is to compare our survey, the Zoe survey, with the other ones, because we've been saying that the confirmed cases of the government is really not currently picking up most of the cases, as it doesn't really record a lot of the lateral flows. And so we're relying on surveys now to see what's going on. So the ONS infection survey came out just a few hours ago, and the total numbers are quite similar to us in what they're estimating. They're always a bit above us because they include asymptomatics. And whereas last week it wasn't clear they were on the same trajectories, now it looks more similar from these graphs. And certainly the unmodeled, the crude data shows an increase in those numbers, although their report suggests, based on their models, that things are flat. But to me, lagging a week or a few days, they're looking pretty similar. So I think it in a way confirms our results of high numbers that really aren't going away and have to take seriously. Now let's look at our friend BA.2, Omicron BA.2 prevalence in the UK, which we did expect to take over the country really rapidly as it happened in Denmark. We're a bit out of not doing as well as Denmark in terms of the sequencing. Really no information for the last 10 days. We can't get information from PCR tests. They've stopped doing them temporarily. So we just got to look, but we do have, and we've stopped sequencing. But there is some partial information, and this comes from Alasdair Grant from East Anglia, who's kindly been plotting all this data for us and spreading the word. And he's shown that based on differences in PCR testing from a number of labs, we can see that there's around 17% of the country on the 6th of February had these proportions, which is around 30% at its highest in London and the southeast, and only less than 5% in the northeast. So big differences which might reflect what's going on at different rates. I think it hasn't gone as fast as we expected, BA.2. It seems to be doubling every 8 days with a serial interval of about 3 days it takes to incubate. So we're not quite sure what's going on. We don't know how much of these increases we're seeing are due to BA.2 or just the original BA.1. But we do know it is more infectious and is very hard to protect yourself against, as probably I find out. Now let's have a look internationally. We can compare the incidence of cases around the world, but it's getting trickier because we're all measuring it in different ways, and some countries are giving up doing it the way they did before. What we observe with South Africa is that although cases are staying low overall, they are seeing small explosions of Omicron BA.2 cases, because they still have very good sequencing in place through smaller regions of the country. And like us, they did see a small second peak when restrictions were relaxed. Scandinavian countries are interesting to look at because they are showing very high levels of infection, and they've never really had major problems before. And the UK cases in comparison still seem to be low, but I think that's an underestimate of perhaps 2 or 3-fold. Even given this, UK is lower than France and the Netherlands and Israel, who, despite having, like Israel having a fourth vaccine, are still getting high infection rates. And some of this might be due to a lack of natural immunity, had less waves and infections than we had in Britain. It's really still quite unclear. Could also be differences in recording. And we know that case data on its own is getting less relevant because it's detached from hospital and deaths. And so if we look at the hospital admissions, really it's reassuring everywhere except perhaps Denmark, where most of their cases are BA.2. It's causing more hospitalizations. Not quite sure why that is, because that's not been reported elsewhere. It could be that there's more susceptible people that hadn't got COVID, other variants earlier in the pandemic. Have to wait and see what's going on there. But in Scandinavia, there's a big movement now, really breaking off from the rest of the world as they're considering saying that it's no longer a socially critical sickness. Sweden halted wide-scale testing for COVID-19, even if people having an infection, as I said, they reached the point where the cost and relevance is no longer justifiable. They've also scrapped pretty much all their restrictions. Norway's government has abolished mandatory testing for all travellers, saying that there was no data that it helped at all, and they're going to be abolishing all their measures within a week. And this is the way I think all countries are going to start going. Inevitably, as we start to live with the virus, we can't have these mandatory rules, particularly when we're seeing this kind of data, large number of cases, but not so much in terms of the consequence that can be actually influenced by the government mandates. The UK government is following suit here with announcement from the government intending to lift the last of these restrictions, particularly isolating requirements a month early at the end of February. We can discuss whether that's a good thing or not. And part of it does depend on the context of whether there's really good public health messaging or not, which I'm sure is better in Scandinavian countries. Now, let's talk about symptoms again, my favourite topic. It gets even more daft every week that the government doesn't recognise any of the other new symptoms and still is stuck in Wuhan territory. Obviously, we all know that 50% of cases now are respiratory symptoms alone, don't get the rest of them. But it's sad to see hospitals and other places still only including questionnaires where they ask about classic symptoms, and anyone can come into hospital with respiratory symptoms of COVID. And it'd be great if we could change that. The current top 20 symptoms we're seeing are broadly the same. You'll notice that back pain has come up the list to number 17, and I noticed that, and it was really very strange and actually quite transient. No idea why that happens, but we keep an eye on these and they will change around, but you can see there's a huge variety in the way people respond to this. And I noticed massive differences between the symptoms I had now than those that I had back in March 2020 with the Wuhan variant, where it was all about chest tightness and nothing up in the nose and mouth. Very different indeed. We've also been looking at some rare side effects of vaccines, symptoms, and one of them is metallic taste in the mouth. And this followed some conversations I had with the eminent doctor John Campbell, who was postulating that some of these rare side effects of vaccines could have been due to excessive doses that might have been signaled by something else going on. And one hypothesis was that metallic taste in the mouth was a sign of that. So based on his hypothesis, we did look at this, and over 5,000 of you reported having metallic taste after a vaccine, and 3.6% of you. And we discussed those results in another video, which we provide a link to. So have a look at that if you're interested in those sort of rare side effects and you had metallic taste. But I want to tell you now about wider health studies. And I mentioned recently we're getting more and more into this, collecting information about what your favourite studies are, but also we want to tell you about a new feature called the Health Profile. And this is your chance to fill in a questionnaire about your medical history, health records, personal well-being. Give us the really top quality data to help us battle cancer, dementia, heart disease, as well as COVID, and give you these insights back in exchange. And I'm going to send you a note when we're ready to share this with you, but it's going to be very soon. And just as an example of what we know already, 13% of you have asthma, and so it's much commoner than many people realise. And you can see the distribution of the condition in the different age groups. And as well as being common in children, it also has another peak in middle age, but also shifts across generations. So very different people born 50 years ago to people born 10 years ago. And we also, with this data, linked asthma and COVID, found that it increased your risk of getting long COVID for reasons we still don't understand. But it didn't increase your risk of generally being hospitalised or having a severe illness or getting more infections. And this is just an example of what we can get from this kind of information. But we'd love to link asthma to other elements of lifestyle and understand how we can start preventing it in children, etc. The other point I want to raise is that the lateral flow tests you're giving us are incredibly valuable, and we're going to give you more insights on that in recent weeks. And do keep giving us those positive and negative results. They are fantastic. And we're going to help you by switching some in the app to make that easier. So you only need a few clicks to do that. And we are just about the only way that lateral flow tests, people with those conditions, are being reported back to the rest of the country, because everyone else has pretty much given up on it or doesn't have a system to really cope with the numbers properly. So keep an eye on your inbox for any updates on the app like that, and we will always welcome your feedback. So in conclusion, we're still seeing really high rates. 1 in 25 people is a hell of a lot of cases. And the good news is that we are seeing some drop expected over the next few weeks, although it's unlikely to get down to anywhere near zero anytime soon, and different parts of the country are going to be going at different rates. Hospitalizations are really low, deaths are really low, ICUs are really low, so I'm relaxed about that side of things. But having had it myself, I know it's not a picnic, and certainly knocks you off energy-wise, mentally as well, and we really don't yet know about long COVID as a sign of that. We still don't know very much about BA.2, apart from it being much more infectious and hard to stop. We don't know if it has any extra side effects. So all of this means it's really valuable that you keep reporting to us, especially now the government is lifting all restrictions and might give the wrong impression that things are over. They're certainly not over. We do need everyone to be good citizens to protect both themselves and others around them without disrupting our lives. And getting that balance right, I think, is really important, and that's why we all need to play our part. We're helping with the app, and your logging of lateral flow tests is increasingly crucial. So do keep an eye on your inbox for all the new things happening, and we welcome your suggestions as always. So thanks again for your support. Stay safe, keep logging.